All right, thank you very much. Well, we are here today with Dr. Jerome Williams, one of our regular guests, Red Mountain Animal Clinic, and Dr. Casey Ray. He is a veterinarian consultant and works with different animals who deal with heart disease. And today in particular, we are talking about cats. Good morning.
Good morning.
Good to see you. So cats are, more quiet and kind of on their own, and so, but they could be dealing with something, dealing with their heart, and you never even know it until they present some kind of symptom, right?
That is correct. Most cats with heart disease do not really show any signs or symptoms, and their heart disease can be pretty advanced before you actually see anything on the outside.
So what is someone like Dr. Williams who would see the cat before they would come to someone like you, what do they look for?
The primary thing you look for is, on physical exam, a heart murmur or an abnormal heart rhythm. If that is heard, then it really needs to be checked out, usually with an echocardiogram, to determine the size and the thickness of the left ventricle and other parts of the heart. Figure out why you're having that abnormal sound or abnormal rhythm. A dog like Jill here can have a heart murmur and be benign. Cats usually don't.
So if it presents as a heart murmur, it is something.
Potentially, and it definitely needs to be checked out.
So veterinarians like myself and other general practitioners need to listen more acutely and tune into those sounds so that we can refer if we hear something abnormal.
That's correct. And the other thing too for owners to recognize is that if their veterinarian hears a murmur and says to have an echocardiogram done, that is not something they need to ignore. It's something that they really should have done. Really,
tell us what we're looking at here.
what you're seeing now is a cat with hypertrophic cardiomyopathy, which is the most common heart disease that we see. What you're looking now there is the big thing in the middle is the left ventricle, and it's thick. And what happens is that it gets thick, the heart chamber gets too small, and it can't pump blood appropriately.
So the wall of the heart is actually thickened. The chamber that is normally nice chamber is smaller and smaller and smaller, and that creates a problem that eventually leads to the death of the cat.
It does. And usually the most common sign that you see, unless they don't go into heart failure, is sudden death. Is very common with that disease.
So there's really no warning sometimes.
Sometimes there's not.
That's very, very sad.
It is.
Is it just part of being a cat? Is it part of who they are?
It's genetic. It's exceedingly common in the cat population. There are definitely some breeds that are more common than others, but just your run-of-the-mill alley cat, yeah, it's very common, and much more common than most people think it is.
All right.
And if caught early enough, it is treatable, or we can provide some treatment for a while?
It's manageable, and then we know what's going on, but all heart disease is progressive, and there's nothing we can do to actually stop the progression. We can only manage it and make them more comfortable.
All right. Dr. Ray, Dr. Williams, Jillian, good to see you.